Hey everybody, it's David. I'm your host of Highway to Health podcast series, and we appreciate you being here. You know, one of the coolest things about hosting this podcast is learning from our guests and learning about the innovations, the disruption that's happening in healthcare to improve a couple things: patient experience, provider experience, access to care, and then also how we're improving the outcomes of our patient community. It's a passion of ours. It's also a passion of every guest that we bring onto the show. They've committed their career, their mind space, everything that they're doing to improving those elements in the healthcare industry. And I'm honored to host this series. And that's why I'm really excited to introduce our guest today. His name is Robin Goldsmith. He's the global lead of connected health and innovation at a small company called Verizon Business. Robin, welcome to Highway to Health.
Good to be here, David.
I'm glad you're here. And we've gotten to know each other a little bit.
Yeah.
I'm very inspired by the work that you guys are doing. We're going to talk a lot about how important it is for companies like Verizon to be shifting the needle in healthcare. Yep. But before we do that, this has become one of my favorite parts of the show, asking our guests to share a healthy habit that they've implemented to improve, to maintain their physical and mental well-being. Do you mind sharing?
No, not at all. I'm passionate about this. So I am pretty addicted to rock climbing. So which kind of combines the physical and mental pieces of being healthy. I love being outside and getting in nature. And an old boss of mine got into rock climbing. So every time we went on a business trip, he'd take me climbing, and it's just kind of went from there. But it's a passion of mine. It's beautiful. It's strenuous. Keeps me in shape. And anytime I try to fit that in when I go on work trips to Las Vegas. There's Red Rock Canyon and Tennessee, North Carolina. So it's great.
A mix of indoor and outdoor, I bet.
Mix of indoor, more indoor than outdoor.
Yeah.
Yeah.
When you are outdoor, you talk about mental well-being. I love being in nature. I love being outside.
Yep.
And there's something about appreciating the creation and enjoying just the environment and the beautiful creation that we're blessed with. So yeah. I bet that's a big part of it.
It is. And, you know, like with rock climbing, I think we're so connected to phones, and which is a good thing for who I work for, but we're just so, connected to our jobs all the time to be able to not be able to focus on that because you're literally having to cling to the wall and you can't focus on anything else. I think clears your mind, and it's good. It's good to reset and do that.
I'm with you. Over the holidays, we always go hunting, and it's in an area where you don't get a whole lot of cell phone service.
Yep.
And it's hard for work, but it's overall good for your body and your mind. And so I can relate. Yeah. Rock climbing is not something I've done a whole lot of, though.
I'll take you rock climbing.
Is it more upper body, lower body, full body? I mean, when you're done, what's exhausting?
I'd say most guys start with their upper body and just muscle it, but it's really the lower body. It's your legs.
Yeah. Biggest muscles in your body.
Yeah, legs, core, and it's arm strength too. Yeah.
Well, I appreciate you sharing that. Sometimes I ask that, and I'm hoping you're okay answering, but that's a cool hobby.
It's fun, yeah.
So let's get into business a little bit. On this podcast, we often talk about it taking a village to get where we want to go on this open road journey, this highway to health.
Yep.
One of the most important, everybody in this village is important. The payers, the providers, the tech solutions, you can even talk about the government and the individual, all playing a part in this journey that we're on together. And the innovators, the disruptors in the technology space come in all sizes. What I appreciated about my time at Salesforce and what I see happening with Verizon is large enterprise companies like Verizon and Salesforce giving validity and credibility to new innovation and building trust with the community, with the industry on some of the new things that are coming to market and really providing the improvement to the access experience and outcomes for our patient population. So, but that kind of begs the question, right? And I kind of want to address the elephant in the room.
Yep.
What the heck is Verizon doing in healthcare? For those that don't know, tell them about it.
I get that question a lot, David. I think the easiest way to explain it, I joined Verizon during the pandemic, where we all were doing this every day with screens and really relying on our phones and our devices and connectivity more than we'd ever done before. That was our lifeline. And when I start talking in that kind of regard, the networks that we all tap into, the the devices, the phones, and in healthcare, more and more medical devices, wearables, sensors, cameras to do everything that we want to do in healthcare. It takes the telcos of the world to provide that enablement highway that everything else is going to be on to do what we want to do in healthcare. So I think if you think about it that way, connectivity and devices is just the enablement. We know our role in healthcare. We're not delivering healthcare. We're helping companies. We're helping physicians have a better experience, get data faster. We're having patients, get to a better experience through just real-time access to care wherever they are.
As we've gotten to learn about each other and our roles, it makes perfect sense to me how it directly aligns with experience, access, and outcomes. Let's start with the experience part on the patient side and the provider side. Okay. You talked about, and I want to start with provider because nothing else happens, nothing else matters without the provider and the provider having the tools, the information that they need to make really good decisions and deliver really great care. Yep. So align Verizon Healthcare with the provider experience.
Yeah, I mean, it's always, unfortunately, we're facing big challenges with the providers, the nurses and doctors that are, really the heroes in healthcare, and I have incredible respect for those folks. But they've been in a marathon event dealing with the pandemic and now coming out of it, so we're facing staffing shortages. So I think where technology can play an incredibly important role is not to replace what those guys and gals do, but to fill in some of the gaps, right? Everyone's running at far below capacity in wings of hospitals all over the country. If you can do things like virtual nurse monitoring, telesitting, utilize technology to fill in the gaps that used to require in-person care from a nurse or a doc, that's a win for them. It opens up their plate a little bit better. If you can give them, mobile devices where they can do their work on the go, that's critical. I mean, we have more and more digital first natives in our nursing and doctors, that they're comfortable with technology. They're used to it. And I think healthcare, and I've said this before, healthcare traditionally has gotten a pass, right? You were given the healthcare that your doctor prescribed to you. You show up in that office at a certain time, you're probably going to wait a while, and then you're going to have your care and go home. That paradigm shift has changed as you look at the Amazon experience, how we can how we engage in our finances, depositing checks through our phone, all those kind of frictionless experiences. Now healthcare is playing catch up because the younger generations expect that same experience that they get with financial services, their retail services. They want that in their healthcare. Yep. So to retain, maintain not only the patients, but the staff, they have to modernize that working environment. And it all kind of goes to the end result of maintaining staff, helping them fill in gaps, and just making them happier, have a better experience.
The experience in other areas of our life is now the expectation in healthcare. And you're right, we've given healthcare a pass for a long time. It's just the way it's always been. That's just the way it has to be. Yeah. But that has shifted, like you said. That paradigm is evolving. Yep. In recent years, the pandemic played a huge part in that. And then
if I may interject, if you think about all the mergers, acquisitions, all the non-traditional folks coming into this space, it makes raising the bar for traditional providers even more important because, they're being challenged on a lot of fronts. So they're having out of necessity. And I think you mentioned the pandemic. I think that proved that we could actually move pretty fast in healthcare when there was necessity, right? I think telemedicine happened pretty much overnight. And if we can do that, we can do a lot of things.
So. Necessity breeds innovation. Yeah. And advancement. And I think we saw that. I also think the pandemic allowed us to break down some of the walls in terms of, traditional places of service, traditional scenes of care, they weren't available anymore. And we almost had, as patients and providers, we had to agree that there was a different way of doing it. And once we were forced to do it in a different way, I think we realized it's not as bad as we may have expected. Yep. That translates really easily and naturally into the patient experience. there's some different demographics, even geographies, that have been heavily impacted over the last few years and have a limited access to care. How has Verizon helped bridge that gap, improve the access to care for the patient community, and how that translates into experience?
Yeah. I think in the pandemic, you saw that those who had devices and connectivity could engage in education, like your kids could go to college, go to high school, engage in their healthcare, have telemedicine visit, and those without fell even further behind. So we spend a lot of time. I mean, I'm proud to work for Verizon. We have a corporate social responsibility team that spends a lot of time on looking at, how can we help? How can we develop programs to make this more inclusive, provide devices and connectivity to folks who are typically in underserved communities. Yeah. Access, I think, is top of mind for every healthcare executive, and that's a kind of a broad term. And I think about access from, people who are living below the poverty line, who, are struggling to get a doctor's appointment for a variety of reasons. They can't take time off work. They might not have a car to drive there. They might live in a rural area where it's 100 miles to the nearest hospital. If we can provide, through the Affordable Connectivity Program, which is highly subsidized to give them connectivity and devices, can we build an actual network in rural environments? A colleague of mine is doing some great work in Alaska on the island of Ketchikan. Really? So basically we created this mini network for the Alaskan tribes out there that had terrible coverage. And that's going to change the game. We're putting in connected kiosks, basically a dock in a box with telehealth, where they can bring in experts from off the island to consult through this very small footprint. So there's a ton of great innovation happening. And I think everyone's talking about health equity and access, social determinants of health, because it'll help all of us if we can take care of our most vulnerable, because they are consuming a lot of healthcare, older folks consuming a lot of healthcare. If we can have more continuity, more touch points with those folks, it brings down the cost for the stakeholders. And I think it's just the right thing to do, first and foremost, but it also, for a number of financial reasons, it's the right thing to do as well.
And when mission and business intersect like that, it's a good solution. It's it's a good opportunity. You talk about the Alaskan community. I mean, you talk about an underserved population, and now you're delivering what maybe they've never had through this kind of innovation and technology. It's powerful stuff.
That's in every. I mean, I live in New York. You drive a couple hours north, and everyone thinks New York City, but it pretty much looks like here in Dallas.
Right.
Or I can pick any state in the country. You get out of a major city, it becomes rural real quick, and you see more dollar stores than you do hospitals by far.
Right.
So, when you think about what happened in the pandemic, the capacity challenges, there's not enough doctors and nurses. We have to use telehealth technology to provide access. And what if, I've got a rare heart condition, and the only doctor or the best doctor in the country is in Arizona at one of the leading hospitals there. If he can consult my doctor in rural New York on really the best practice for me, that's how it needs to go to, for a whole host of reasons.
Yeah, and it goes back to that village idea.
Yeah.
It's going to take everybody.
Yep.
And sometimes we're not conveniently located. I've grown up in small towns kind of my whole life. My family and I moved to a small town about 5 years ago, about 70 miles west of here. And, we have 4 kids. There are going to be things that happen with kids that are playing sports. But for the minor things, for the things that could be handled without driving 40 miles into Fort Worth, telehealth has opened up our access to care personally.
Yeah.
To get the care that we need and to let mom sleep better at night.
I bet. Which makes your life better.
Yeah, exactly. So we've talked a little bit about patient access and the communities that it's improving. The access to care in my mind, it includes all the elements, right? Not only location, but affordability, all those things. It also improves the outcomes. And I'd like to get your perspective on this, and then I'll add anything that I can think of. But how does access to care and taking care of things earlier, more often, maybe even preventively, how does that improved outcomes for our patient population as a whole. And then I'd even like you to expand on the stress that it takes off the health system if we can improve those outcomes earlier.
Yeah. So, if you only go to your doctor once or twice a year, that's a snapshot in time. It's not great for the provider to see me once, twice a year. That's way too much time. A lot can happen in 6 months. Really, what we need to get to is, ongoing care, ongoing data points in my care journey, especially if you have a chronic condition that needs attention. Ultimately, where we need to get to is utilizing what we call RPM, or remote patient monitoring. So if I have a heart condition, I've got a wearable. If I got diabetes, I've got a continuous glucose monitor. Those wearables, those devices that sit in the home that monitor my health, that's being adopted rapidly because there's reimbursement, first of all, and it's leading to better outcomes. Because if David's got diabetes and he's really not compliant and he gets sick every couple months, that's very expensive. But if you got devices that are monitoring your insulin levels, and if there's a spike, sends a message to your doctor, you get a call, that care plan and the caregivers know, all the ins and outs of that leads to far better outcomes. And in the long run, it's a lot more affordable. It's putting less stress on the healthcare system. And to be honest, go figure, people want to be in their home and they don't want to go to hospitals.
Right.
No offense to hospitals. They're have incredible admiration. They're delivering incredible care, but there are also risks in getting infected in the hospital. There's a lot of side effects. It's not the most, you're comfortable in your home. People like to be in their home. The data shows that if you can treat someone in their home, in hospital at home, or all these programs that are starting to bubble up and advance and evolve, the outcomes are better. And just for a number of reasons. Less stress on the patient. And I've got a great story. We work with a well-known children's hospital. And to your point, you've got 4 kids. So if your kid was sick and the only person in the world, and you want to give them the best care, but they happen to be in another city, you would do anything for your child, right? And you fly them, and that's expensive time off work. If you can have those kind of routine visits through technology and video type capabilities, what a win that is,
right?
And so that's what gets me out of bed in the morning, to try to, tell what we can do and enable in healthcare. Because I think we've been doing this for a long time. I just think the visibility and awareness of where we want to play a role is important to tell the wider community.
Well, it's unseen in a lot of ways. The outcomes are seen and felt.
Yeah.
But you don't always know how or where all of this is happening. As you're talking through these wearables and these additional devices and more care being delivered outside the walls of a hospital, traditionally our concern would be security of data.
Yep.
Especially in the transmission of data and the communication between the care coordination team, the care team that's happening, that's rendering services outside of the traditional setting. How has Verizon been able to settle some of those concerns around security and patient data?
Yeah, unfortunately, it's top of mind for every healthcare system. Unfortunately, you see too many breaches, ransomware attacks in the news, and the consequences are dire, right? Hospitals having to go back to paper, completely taken offline because they've got a ransomware attack. Before I joined Verizon, I had no idea the depth and breadth of our security practice. We've got incredible experts that have come over, and we've built this up over time. So it's a huge strength of Verizon, where we can basically secure any attack surface, as we call it.
Yeah.
And to your point, as you start putting more devices in the home, it's windows for bad actors.
Right.
So those all have to be completely buttoned down, wrapped in security. And then if you think about Wi-Fi versus a cellular network, Wi-Fi is far more easy to breach. And I have nothing against Wi-Fi. I think we sell a lot of Wi-Fi solutions, so it's all good. But cellular networks, and then you talk about, to take it a step further, like private cellular networks, by their design, they're inherently more secure. Okay. So that's, for our business clients, our hospitals, they're now, security is top of mind. And they fell behind because they had priorities like keeping us all healthy during the pandemic.
Right.
So financial services, manufacturing, they're a little bit ahead of the game. So I think healthcare is now really focused on securing both the home environments, their networks and hospitals, and we're a partner for that. We've got a great security practice to do that.
It's almost table stakes now.
Yeah.
Because of all the different data points and open windows for bad actors. So we have the busy season coming up. You and I will be at Vive.
I'm excited.
In a few weeks.
Yeah.
Him shortly after that. Some of the biggest events of the year happen in the first half of the year. These events, I think, are huge for us in the healthcare space, especially when talking about innovation. The challenge is these providers, these businesses that we work with are so busy with their day-to-day, it's hard for them to learn and be educated on the innovations and the updates, the advancements that are happening outside of their own walls.
Yep.
How are you leveraging these events and other opportunities to provide the education to these businesses, to these providers, so that they can perform at the highest level for their communities?
Yeah, for us, I'm in innovation and strategy. Part of my job is to see what's happening, the latest and greatest, see the technologies, and then bring those back to our customers and say, these make sense. We've vetted these for you. Because I think, there's a lot of money at stake in healthcare, and there's a lot of companies that have been spun up to address issues. I think a lot of that's kind of coming down. It's level setting. I think now, unless you have really a true valuable, what's the right term for it? You have to bring value, you have to prove out, you have to have had patients on your platform, shown results. It's not just throwing money at the wall, you have to have adoption really to prove it out, because money is still incredibly tight in healthcare. Yeah. So part of our job is to vet those folks and take them, if they need cellular connectivity, we'll vet them, make sure that connection's safe, secure, and then bring those solutions to our customer base.
What other strategies are you leveraging to make sure that you are communicating the message and the education, the engagement to those communities outside of events?
Yeah, thank you for asking. We do have a podcast, so it's nice to be on the other side for once, David, not asking the questions. So
you do a great job, by the way.
Thank you.
Yeah,
it's been fun, and I've got a great team helping do it, and you guys have been a great partner doing this. We started the podcast really to do what we were talking about, just evangelize what Verizon can do in healthcare, because awareness was just not there. So we really wanted to bring on guests that are incredibly smart, doctors, clinicians, talk about the problems facing healthcare, and it's really just to have that conversation and position ourselves that we have a point of view, we have a role to play in healthcare, and I think now more than ever, connectivity, devices, security are, they interweave through every fabric of healthcare.
Absolutely.
So just getting that message out there, and the podcast has been a really fun venue to do that.
It is fun, and you get to bring on great guests that are doing some great things and celebrate them. So what's next? We've talked about some of the great things that you guys are doing, where the business has come and how the industry has benefited. But with the progress that we've seen lately, what's the next big step for healthcare in general or Verizon Business?
I think we continue to listen to our customers, and what we hear, primarily is this whole decentralization of care because of the staffing shortages and the challenges folks are, trying to keep patients, move them to value-based care and not fee-for-service. That's a huge initiative, and we're trying to align to that. So if we can provide secure connectivity in folks' houses, make sure they have access to connectivity, the right devices that are secure, that's going to get to better outcomes for everyone. So it's a continuation of that. And then in the hospital environment, I think it's, someone's building a new hospital or modernizing their existing infrastructure. If we can give them, a fabric of connectivity that sets them up for the future and enables everything they want to do, like AI, moving data in real time, AR, VR, all these buzzwords, for me, that's just how can I help those hospitals move data in more real time so doctors can get those images back faster. If it's a complex, heavy file they need to review, be able to do all these real-time capabilities in the hospital, that's where we can really make a difference. So
all the innovations happening outside of Verizon rely on data and the transmission of data.
Yep.
And without a trusted partner, a capable partner like Verizon, those providers, those communities can't get the benefit from all of this extra data, all of these extra technologies and functionalities and features, because they can't transmit and they can't communicate. If you don't mind, this isn't something we prepped on, so I'm going to throw you on.
All right.
But value-based care is probably, it has more momentum now than it has in the last 15 years. We've been talking about it for a while, but the adoption, implementation, and communication around value-based care has really increased lately. And I think it's back to our earlier point, it's about necessity. What I know about value-based care is we're going to start relying on more and more people to render care to the same patient, and these different care teams have to be connected. If you don't mind spending a few minutes, how important is connectivity with different teams, disparate teams, even teams that historically haven't been connected or communicated together?
Yep.
How are those different teams coming together and being connected going to impact in a positive way this transition to value-based care?
Yeah, I mean, it's something I'm super passionate about. I'm very privileged. I get to talk to doctors and nurses and people working at healthcare executives, and I think we all want to get to the same place, because I think where we are now is pretty unsustainable, right? And we have a system that's based on sick care. You're compensated when you're reactive and you're helping David, he's got a bad heart. We're giving him state-of-the-art care to get him back online, where really we should be interjecting a lot earlier with all kinds of digital health programs, healthy eating, all the things we know we should be doing, but in a more digital, meeting that patient where they are on their phone or tablet in the home. That shift has to happen. And I think it's going to take some courage. And I think it's going to take some leaders out there, some of the top name hospitals and insurers. And you're seeing the insurance companies start to do it, right? They're providing connectivity and devices sometimes for free, because it's a lot cheaper for them to give that to a patient so they can have, more continuity of care than them showing up at the ED and having a, progressed health condition that costs everybody a lot of money. So I think it's critical, and I think we have a really good role to play there in just connecting those teams that are now going to be in the home, in the ambulance, in the hospital, and then on the go. If you can kind of have that 360 view of the patient wherever they are, and connect the teams that are servicing those patients wherever they are, that's going to get us to where we need to go. Yeah. It's going to take a while. Healthcare is not easy, but we're on the road, and I'm seeing progress. I'm an eternal optimist, because I get to speak to folks like you and people that are passionate about it, and people trying to do the right thing. And I think we just need to do it, because it's gonna for all the reasons we know, it's gonna just get us to better outcomes, which benefit us as a society.
In so many ways.
At the end of the day.
Yeah, in so many ways. It'll take a lot of stress off our providers too, which is sorely needed. Traditionally, 98% of healthcare was rendered inside the hospital walls or the clinic's walls, but 98% of life happened outside of those walls.
Exactly.
And over the last few years, through technologies and partners like Verizon, we've started to see a blend of those percentages, of those in a more balanced way, where more care, more communication, more education to the patient is happening outside of those walls, and the data that's happening regarding their life and their health outside of those walls is being better communicated to the provider, and we're making better decisions because of it.
Yep.
And I think that's how we're going to get to where we want to be. We've talked about a lot.
We have.
If you were to give our listeners, one takeaway, if they walked away understanding one thing, what would that one thing be?
We've touched on this, but I think, I'm very proud of the team we have at Verizon, and we have a lot of passionate folks that can really bring our solutions to bear to enable our very trusted healthcare providers that are, moving care into the home. And then in the four walls of the hospital right now, we can assist. We can be that highway to carry that data, to enable those solutions in more and more real time, and really get to better outcomes, better patient experiences, get the nurses and doctors, give them a little bit of help through our device, through what we do every day across all the verticals. I think it's, for us, we want to help the cause in healthcare and be a key seat at the table.
Well, you've been a huge part in so many different industries, and you're taking a lot of the expectations and experience in other industries and bringing those to healthcare. I appreciate you being here for one, using Highway more than once.
I did.
And for our listeners, here on Highway to Health, we're talking about Verizon bringing the highway of data and communication to healthcare, which is only going to improve access, experience, and outcomes for our patient and provider population and communities. So appreciate you being here.
That was
Good luck at Vive.
Thank you, buddy. I'll see you there.
All right.